Hello and welcome. I'm your host, Ramesh Kumar, and I'm on a mission to bring value to the healthcare industry through improved transparency. And my goal from this podcast is to give you one aha moment that you can implement in your business, whether you're a TPA, broker, or an employer. In my day job, I run a company called Zaki Point Health that helps self-insured employers and their employees provide transparency, direction, and value by delivering a digital front door for the member that proactively steers them. Please like or share this podcast on your favorite podcasting tool so we can bring together a community of like-minded professionals. This program is brought to you by the Healthcare Administrators Association, HCAA. For over 40 years, HCAA has supported third-party administrators and the self-insured employer industry through educational opportunities from leading industry experts. For information on joining HCAA, please visit our website at hcaa.org. Our new sponsor for the 2024 season is Valence Health. Valence Health is the platform to simplify healthcare, the destination for employers, payers, providers, and members to reduce costs, improve quality, and elevate the healthcare experience. The Valence mindset and culture of innovation combines to create integrated solutions. Valence engages early and often to execute across the entire patient journey, from care navigation and management to payment integrity, plan performance, and provider verification. With a 99% client retention rate, Valence Health elevates the expectations to a new level of efficiency, effectiveness, and transparency where smarter, better, faster healthcare is possible. For more information, visit valencehealth.com. I have been chasing Kirti Mutatkar, CEO of UnitedAg, for this podcast for a long time. So I'm so happy to present to you this episode that goes into depths of what you can do and leverage from Healthcare Administrator Association. Kirti is not only the CEO of UnitedAg, she is the president of HCAA. And in this episode, we are going to cover a bunch of things like how she tripled UnitedAg's business by leveraging resources, ideas, and inspiration from attending HCAA events, and what is the value to the TPA or the broker and the employer from the resources available through HCAA. How can you help your employer provide affordable healthcare leveraging the network of HCAA members and resources? How have things like the digital programs that are available, like webinars, podcasts, and other things, versus the live events at HCAA that can help not just you and your team members to access things, and how can those be useful? And now that she's also the president of HCAA, you'll get to learn about what to expect over the next 2 years from HCAA. So let's dig in. Kirti, I am super excited to have you on our podcast, Voices of Self-Funding. You and I have known each other for a number of years. We have collaborated at HCAA on bringing innovation, bringing new ideas, whether that has been care navigation ideas to artificial intelligence to digital programs. So it is my honor to have you on our podcast today, and there's so much for us to discuss. But let me throw the ball towards you and say, why don't you tell our audience your background and what has led you to be the president of UnitedAg and now the president of HCAA? Why should our audience listen to you?
I don't know why the audience needs to listen to me, but the reason I am here is because I am actually super, super passionate about bringing about a change in healthcare. That's where my passion lies. And usually when I get on these podcasts or in the podcast I do, This is Ag, the reason I do podcast and I get excited about that is at the end of the podcast, I want to learn something from this conversation. So Ramesh, every time I've talked to you, I've walked away being either inspired or it has led me to change something that I was thinking or saying, oh, maybe I need to look at it from this perspective. I'm okay if the audience don't listen to me, but what I'm going to do is totally enjoy this conversation because I love having these conversations with you. You want me to introduce myself and go?
That would be great.
I am the president and CEO of UnitedAg. So UnitedAg is actually a health plan for the agricultural industry in California and Arizona. And we also have a TPA that administers the health plan. And that's where me coming in as a president at HCAA. I've done this for a few years. I was a CFO before, transition to the CEO role. And the exciting part of the CEO role, when I first came in a couple of years ago as a CEO, I used to talk about putting human at the center of everything that we do in healthcare. And sometimes when you hear people say that, people think, oh, what is this lady talking about? Right? It seems fluff. But I joined UnitedAg when we were $80 million in contribution revenue. Today, we're going to end at 255. So we've tripled in size in that span of me coming in as a CEO. But what more importantly, I don't think it's about me and me feeling egoistical that we've done this, but more importantly, what it says, that putting the human at the center of everything that we do from a healthcare standpoint does have a business impact and a financial impact. And that's the one I'm super excited about, that we've achieved success with that.
Wow, this is great achievement, tripling the business and taking care of patients. So you've been involved with HCAA throughout that, and much of our discussion today is going to be about the value of HCAA to our ecosystem. How has United Ag benefited from being associated with HCAA over the last number of years?
So I've been part of HCA for quite a few years, even during my CFO days. And the reason, especially when you come in as a CEO of an organization and you're new to it, the most valuable resource you can have is your time. So you have to be really intentional about where you spend that time. And the first couple, when I attended the HCA conference or getting to know HCA, the participants and the TPAs who are part of it and the employers who are part of it, you always walk away with getting something that gets you thinking in a different way and you can bring back to what you do at UnitedAg, right? So it gets you thinking from an innovative standpoint, from a technology standpoint, from anything that you can come back and introduce. So it's always, as my journey progressed at UnitedAg, HCA has been a big part of some of the takeaways I've gotten from conversations I've had, being on the content committee, being on the board, attending these conferences, and lots of things that I come back and implement at UnitedAg, and it's been awesome. And I actually do not choose to go to quite a few conferences because my time is limited. I have quite a few things going on, but HCA is one that I definitely make time for because it actually has an impact on what I do from a day-to-day standpoint and at UnitedAg.
So I'm going to push you a little bit. I want to hear a story, an event, or a particular aha moment you had from an HCAA, whether it was podcast, whether it was live event, and how did you implement that aha moment?
So this was a couple years ago, and there was somebody who was talking. It was not a direct kind of, it was a session maybe, I don't know, but the session just triggered something in my head. And this was around customer service. We call out customer service member services, and it was around customer service and provider calls and employer calls and where should the focus be, right? And as me being passionate about putting the human at the center, so this idea emerged after one of our conferences at HCA. This was at the Executive Forum a few years ago. And we, looking at it, I was thinking through this, how do you focus more on the members of the employer groups and how can we switch that around? And out of that came our member advocacy program. So we have something called the member advocacy program at UnitedAg. So the way it works is, let's say you call in, so Ramesh calls in and maybe somebody you know or you've been just diagnosed with something and you're really scared about it and you don't know how to navigate this process, starting from pre-authorization or getting your approvals, getting your appointments, or even the EOBs coming in with all these diagnoses comes in or the cost associated with that. You are at a loss, right? First, the diagnosis comes in and you don't know what that means to your health. But at the same time, you have all these things that you want to navigate through and need help on. So you call UnitedAg, a member advocacy program. You get assigned to one member. The member actually stands next to you and helps you throughout your process. And including your bills that come in, or you might say, oh, I'm not getting doctor appointments. You might say, I need some of pre-authorization done. So this person actually becomes your brother, your sister, your mom, your dad, standing right next to you and saying, don't worry about this, Ramesh. You handle your health part of it, we'll handle everything else. And this idea, the birth of this idea, happened at an executive forum, and maybe not directly related to a session, but what it did in my head, it flipped something for me in my head and say, we need to go back and implement this. And it has been extremely successful for us, the member advocacy program at UnitedAg.
Well, that's a fantastic thing to hear. I think sometimes it's not just the one learning, it's the accumulation of number of learnings and then a catalyst where you might get inspired by talking to somebody at a live event. That's how new ideas are born and birthed.
Exactly.
And countries have been formed that way. So certainly a member advocacy program can benefit from these connections at HCAA.
When you think of from a technology standpoint too, right? This was just a recent July thing that we did. And I actually moderated an event. And the reason that was impactful was as we are putting a session together, you are actually spending a couple months prior to actually putting that session on at the conference. And that triggered so many technology changes within UnitedAg. Example, Parrot AI. Now we don't do a meeting without Parrot AI because that really summarizes things. We had some learnings. We had people from outside the healthcare industry come in to look at the problems within healthcare. So our retention problem, our revenue problem, other issues that we see within the TPA industry, and say, this is how somebody outside handled this. So can we take that and apply it? And we actually did the session, and lots of learnings came from that, which we've started implementing at UnitedAg. Just the SPD and the searching the SPDs for how do you provide when your member calls in, how do you have member services, have been equipped with all the information that you can answer those questions, right? That's all the AI and technology that you can use to help our member services team. That's come out of this technology session. So it's really a lot of things. You come out of the conference and you think you want one nugget, but you walk away with quite a few. So technology changes in the last couple months at UnitedAg since we came back from the July conference. I would think already implemented 4 or 5 things. So
wow, that's impressive. That's impressive. So for our listeners out there, just take action, sounds like.
Yeah.
How about your team? What have they gained out of attending HCAA events?
I usually have the executive forum. My executive team joins me at those forums. And the TPA summit, I usually have people involved in operations and claims and stuff coming in. And I also have my emerging leaders be part of the emerging leaders program, because as they're coming into and learning to move on to the next stage of their career, they get a lot out of it, right? So there are a lot of networking that happens, a lot of exchange of ideas that happens at this emerging leaders sessions. So they've come back. Actually, my director of member services was at the executive forum last year. And I think it was during your mastermind dinner, one of the dinners that you host at the session, there was a conversation around now taking member services to the next level of how can you use technology to augment what you do. So you keep the people aspect of it, but how do you make sure the member services team members' life is as efficient as possible behind the scenes? So a call comes in and that person has access to everything related to this member, right? From interactions that you've had, from your plan benefits, everything is one stop, get all that information out. That's something that came out of your mastermind discussion. And Sonia, who heads our director of member services, was super excited about it. And the other thing that some of these sessions happen for our team members and why I get excited to take them to the conferences, the executive forum or the TPA summit, is you might not have that one takeaway that you might implement back, but what happens is it's re-energizes and re-engages the team. So they come out of it so re-energized that the next week they're talking about, oh, I want to try this and I want to try that. It might not be related to what they heard at the conference, but it just gets them super excited about what they do and how that impacts. That's one of the reasons I take them, because just to see what others are doing, the sessions are very inspiring, innovative. So you kind of listen to them and you get energized by them. So that's been really impactful too. So I pick and choose my employees and get them re-energized. They come back with just the idea, and that trigger goes into like the movie Inception. You put an idea in somebody's head and the idea just trigger, like goes off in different direction. So all you need to do is put that one idea in somebody's head, right? And then you just see it explode. And that's what happens to my team members.
So the motivation and idea kind of catalyst. If you were to kind of zoom back up a little bit, HCA serves TPAs, serves brokers, employers, and vendor partners as well. What is the value to these different entities for being part of HCAA?
I feel like the bigger picture first is, look, being a TPA, it helps from bringing your cost down. I think that's at the core of everything that we do from a membership standpoint. It makes it flexible. It makes it transparent. It makes it looking at it from a big picture, right? That's what the TPA industry does. So HCA supports the TPA industry, and in a way to make it grow and get those resources to the TPA industry, right? And that's the big impact. And looking at it from brokers or other vendors who are coming in. So for vendors, for example, let's pull that out. So when you come in as a vendor to the HCA conferences, yeah, you get those clients and stuff, and you're building the relationship, and you increase and you grow from attending the HCA conferences. But the other thing that does is during HCA, which is very unique to HCA, I don't think any other conferences or any other places this happens, but the vendors and the same areas where the sessions are happening. But what happens because of that is the vendors are listening to the content that's being presented, and the content is very forward thinking, future thinking, and they're listening to this. So as they take it back, they are looking at the solutions that they can provide, and we look at that and say, is that really relatable to the TPA? So it helps them from rethinking their business models a little bit and gives them ideas. And also the growth that happens as your relationships build with an employer. So it helps them, the vendors, brokers, employers, TPAs, education, the content that we have, and everything I've talked about earlier, from re-energizing you and triggering those ideas that actually very actionable. Everything is very actionable that happens at HCA that you can actually take back and use it and build from there. And most of the vendors that I attracted to HCA, the other thing when you talked about this earlier on why I felt the need to stay on with HCA, I like to see the vendor list of who sponsors and who are part of this, because I find that signals something for me. So when you see vendors really involved with the HCA, and to the point that they're part of a content committee or they're part of sponsorship and stuff, what triggers to me as a TPA is, this is an innovative, future thinking vendor, and I want to have a relationship with them. That's a very signaling thing I see from that HCA can provide.
And I would just second that. My experience as a vendor in the HCA at the events itself is like being in those rooms, you get to really hear the problems that the employer or the TPA or the broker is facing. And we as a community can then innovate. We as a community of thinkers, technologists, solution providers can think about, well, what is a better way to solve this problem? So it certainly has helped me and our company, and obviously the relationships that you build, not necessarily just for the immediate sales or whatnot, but you start to build relationships that give meaning to your work.
Right.
So I'll just add to that, which is we're all in this space in healthcare, trying to make healthcare better, trying to reduce costs and improve outcomes. And when you are with like-minded people who are doing the same thing day in, day out, you just get excited and you build relationships.
Agreed.
Yeah.
Because when you look at a value proposition from your end as a vendor, if you just look at it from, did I go to the conference and did I get 5, well, whatever that looks like, a sale, did I get that from this conference? Is that truly a measure of what you're getting out of this association versus did it get me create something for my business that now helps me grow, and looking at my product and what works, what does not work, because you're getting the first hand front seat to see what's innovative. You're getting to see what's painful, right? And all you're trying to do is to solve that pain, right? It's definitely more than just a numbers game, I would think.
How about an employer? We're trying to serve employers. How can an employer use the resources of HCAA to provide an affordable healthcare to their employees? What is out there for them?
When you look at the TPA, any employers who are looking at a TPA, you're self-funded employers, right? So they want to be engaged with their providing that health insurance. You already know that this employer is going to be more engaged. And when you are engaged, but you're relying more on your TPA or you're relying more on your broker to tell you what's impactful for you, it's okay in a way. But if you get yourself educated in what needs to happen to provide that best care possible for your employees, that's a win-win, right? You get a good TPA, you get a good broker, of course, they'll do all the work for you. But if you take a back seat on it and let somebody else lead it, you might not get what you want out of it. So to understand what's out there, what's front and center, what innovative things are happening, transparency, right? So many TPAs out there, so many brokers out there. How do I choose the best TPA to work with? How do I choose the best broker to work with? Do they know? Are they forward thinking? Are they thinking about providing? How does that happen from my employee standpoint? So all that to educate an employer, you should attend these meetings, because when I'm looking at UnitedAg from an employer, if I put on my employer cap, if I don't understand something and I rely just on my TPA or my broker on it, I'm not going to make good decisions at all for my employees. I need to be educated. So definitely having the HR person or somebody from the CFO or that side of things to attend and understand what's front and center, what's happening in this industry is very beneficial, I would think.
And are there certain solutions they can access? Are there plan designs or technology or compliance? What are some of the things they could be expecting?
I think all the rules and compliance thing that keep changing. So we give these updates during the time. From technology, there's so much happening in technology right now that anytime you move forward, you might be slower, right? Even if you're moving at a fast speed. To understand from that standpoint, from an employer, the whole thing with now how the ID cards and the QR codes and your open enrollment and how that happens and how you can streamline this whole processes from an internal standpoint. We had a session on that, if you remember the TPA summit, the whole open enrollment and what that happens for your HR team. If just listening to some of these things and getting ideas on it and using that, it was basically having a QR code on your enrollment form or your ID card, and you just take the picture of that and it's uploaded. And your ID card also shows up on your wallet, and it's like a boarding pass that you can just use anywhere. You can email it to the provider. All this, the TPAs and the brokers can help. But if the employer knows it, and then they know the culture of their own employer, their own company, they have to see how that melds into that. Because when you think of agriculture, a lot of people think, oh, agriculture, all these technology things might not work. And they might not even bring these technologically forward thinking, because they're like, oh, this works on a smartphone. I'm like, this is paper, this is ag. But if I don't understand what's out there, I know my culture and I know what happens, then there'll be a disconnect between what my broker or TPA is telling me and what I'm actually looking for. So I understand my culture more than anybody else, and that would be.
So there's a whole range there. And I know HCA does digital programs and they do live events. How are those helping? Which of those are, would you say, helpful to the employer, TPA, or the broker? And how are they helpful?
I will answer this question because I just have something in my inbox from HCA. That's the webinar on the GLPs and the impact on cost and pharmacy. And I saw that. I forwarded that to a few members of my team. They're all logging in to listen to that. That's from an employer, that helps, right? Because what's happening with these drugs. From a TPA, that's important to know what's happening with this drug. From a broker, that's good information. So this is just actually, if people listen to this and like, it's right in the inbox right now. I think the webinar is next week. That's helpful. There was another webinar that actually you had put together with Zaki Point and your now relationship with WLT and what you're doing with that. When I saw that come through, I again did the very similar thing, and some of our team members are engaging with that to understand, to see how that fits within what we do. So all these webinars that are happening are very timely, that the content committee and Carol Berry, who's our CEO, puts that together. So very timely, very important. So definitely everybody benefits from there. And even listening to the recording, so you just register for it and you get the recording later. That's what I do. There are lots of nuggets in there.
Obviously, we shouldn't forget the podcast. They are the best. How about the live events? How are they helping members?
It's the sessions, like I said, and the nuggets that you get from them and the conversations that happen then around that. So when you listen to something that has triggered in you a creative idea, then you get to discuss that during lunch or during dinner, and that idea just gets bigger, right? So the thought gets put in your head in a session, but what follows after with the people, like you said, the like-minded people in the discussions you have, it takes it forward, or you have it with the vendor that you're working with, and work with that person and take it for the vendor and move it forward. So there is live session is impactful because sometimes it's not the planned things that can create those ideas. Sometimes it's the unplanned. I could be walking up and getting a cup of coffee and I come across you and I'm like, oh, wasn't the session on technology so impactful? And you might just happen to say, yeah, that's something that Zaki Point is working on. And I'm like, oh, tell me more. Just those casual conversations that happen, very impactful. I've seen that. I mean, like, a lot happens in between the sessions and during those coffee breaks and lunch breaks and dinners. But the session serves as a trigger, right?
Yeah, the two things my coach talks a lot about this, is breaking bread with fellow people in the industry. It's so important to really going deeper in understanding and building the relationship and really learning from your colleagues. The other part he says a lot is it's not what's hot, it's what's caught that matters the most at the end of the day. And so when we go to these events, it's not just the content that's being taught there, but the side kind of conversations. So what do you think of that session? How was that helpful? And what you catch from that is really what you take home for the impact that you can have in your own organizations.
Yeah, sometimes it's what is it that you did not like about the session also triggers that, right? Because it's like, oh, this person said this and I don't necessarily agree with that. And the discussion of why you don't agree with that leads to something too, which I actually find that super exciting too.
Yeah. So now that you are the president of HCAA and you've got, I'm sure, many ideas over the next 2 to 3 years, what should we be expecting over the next 2 years to be coming out of HCAA?
I am, as I think some of you saw that the HCAA TPA Summit, I'm a super passionate, high energy person. So just by me being me, it's going to be high energy the next 2 years. And I usually don't, when I think of, oh, what's your legacy and stuff, I'm not big on that at all. I don't want to leave a legacy or something. But what I would like to leave is at the end, 2 years from today, when I step down, is I want to see an increased engagement from everybody who we think as a member of our HCA organization. I want engagement. I want to engage with them, get feedback from them, and build this HCA, take HCA to the next level together, right? Because it's not the one person at the top, it's not the CEO, it's not the team, it's not the board, it's not the content committee, but it is all of us as members of HCA. We can together combine and take it to the next level. So that's what I would like to see. I would like to see increased engagement. I would like to see increased energy flowing into this, because HCA is an important trade association, and there's a need for this association to be here at this time because of where the industry is going. It's extremely important. And I just want to create an excitement around being part of this. I think that's what I would like to see.
I can feel it. I can feel the excitement on your face, and your voice says it. And I remember your opening speech as well. So I'm certainly looking forward to that engagement, the energy level, and how we could go out and produce and create new things, create that creative atmosphere so that new ideas come out of that energy as well. Any particular programs that you are excited about that we should be looking out for?
Not any programs as such, but when you said my speech, right? One of the things, that reason I talked about the landing on the moon is when you think of landing of the moon, you think Neil Armstrong, right? That's where you're Aldrin. You think of those people, but there's so many people who feel when that happened that day, right? A lot of people felt that they were part of it. And that's what I want to do it. That's what would be very fun at HCAA. It's like people shouldn't be remembering, oh, this is what happened in the 2 years of this person's or this chairmanship's term or president's term, but everybody feeling, I made it happen. Every member feels because of me, HCAA is here. Every broker feels because of me, HCAA is here. Every vendor feels because of me, HCAA is here. And if we all feel we're part of something that has happened, and 2 years from today, if everybody says, of course this was me, this is the reason HCAA is the next level, of course it's because of me. If that happens, that would be super cool. I hope that happens.
Wow, inviting people to feel part of this and to see themselves in the many faces of HCAA so that they can contribute and feel they can have an impact.
Yep. And what I would like to see from everyone is people reach out to me, email me, send me things saying, hey, this is not working. You just said you want me to engage, but I don't feel engaged. I would love to hear why you're not engaged. I would love to see what are your ideas from what you would like to see from HCAA. I would like to, if you want to get more involved, yep, of course we want you to get more involved and be part of either the board or the committees. But if you don't want to get more involved, but you have ideas and you just have all these painful things that you think about HCAA, anything, good, bad, or the ugly, right? Send it my way. I would love to hear that. That would be my call to action.
Well, this is great. There you have it, our listeners. Kirti is putting her money where her mouth is. She's asking for engagement. And I really want to thank you, Kirti, for the time and sharing of the ideas. It's been a wonderful conversation.
Thanks, Ramesh. As always, I get energized after I talk to you. So that's a win for me. Thank you. Thank you for what you do.
And I would like to thank Valence Health, our sponsor of this show. Please join us again for another podcast in the series brought to you by HCAA's Voices of Self-Funding. Please like and share so we can build a community of like-minded people. And tell us about topics that we should bring to you next. Please watch your email for updates and upcoming guests. I'm your host, Ramesh Kumar of Saki Point Health.